My name is Riley Daniels, and presenting with me today is Grace Mansueto and Emily Kemper. The other people who worked on our presentation were Elise Ash, Julia Dawson, and Sierra Kostomsky. We're all from the College of Nursing and decided to do our project on educating traditional BSN students on safe sleep practices and teaching students how to teach parents. These are some of the problems we identified that helped us narrow down that this is what we wanted our project to be about. We found that in the United States, and especially here in Hamilton County, that there is a very high rate of infant mortality. Of those infant deaths, 14% in Hamilton County from 2015 to 2019 were sleep-related, which means that they are preventable. We identified that healthcare professionals were unable to identify unsafe sleep practices, and from one of our articles found that 73% of healthcare professionals recommended side sleeping for infants, and 28% of nursing students interviewed indicated that sleeping prone, which means on their stomach, was acceptable or did not know the current AAP guidelines for safe sleep. Both of these beliefs are incorrect for safe sleep practices. We also identified through our own experience in our curriculum that BSN students felt unequipped to talk to new parents about safe sleep. Our project goals were to educate BSN students about safe sleep practices and teaching BSN students how to talk to parents about safe sleep.
Through our research, we found some themes that contribute to the high infant mortality rate, such as incorrect modeling of safe sleep practices in hospitals and discrepancies between hospitals that leads to confusion among parents about what safe sleep really is. We found important correct teaching and education techniques, such as active listening and telling parents what the incorrect practices are and showing them how to implement correct practices into their homes after their children leave the hospital. We also found some common misconceptions about safe sleep, such as some parents believe that bed sharing is safer than just the baby in the crib alone because they believe they can keep a closer eye on their children. All of these themes helped us implement an education plan. This education plan was a video presentation with a PowerPoint that we gave to the junior BSN OB nursing clinical students during their clinical day. We gave them a crib audit and correct family teaching techniques were demonstrated to them as well as the crib audit. We gave them pre and post tests to determine the education plan. And we also assigned them crib audits to do during their clinical day.
In our pretest, we saw that 96% of respondents knew what the ABCs of safe sleep were, and that most respondents were able to correctly identify the proper response of the RN to unsafe sleep practices. We did not see a significant difference in these two questions in our post-test, but where we did see a significant difference was in our Likert scale questions. We asked two questions. How confident do you feel in identifying unsafe sleep practices on a scale of 0 to 10? What level of knowledge do you feel you have to talk to parents effectively about safe sleep practices on a scale of 0 to 10? As you can see in the graph, there is a significant difference between the pre-test and the post-test. The pre-test is the lighter blue color and the post-test is the darker blue. There was a significant increase in the level of confidence and knowledge among our respondents. In conclusion, from our research and results, we have noticed that students seem to have a good understanding of what safe sleep is and what the guidelines are. And we believe that there can be an improvement in the BSN curriculum by including education on how to communicate well with parents about safe sleep. And considering that infant death from sleep-related causes is preventable, by educating nursing students on how to communicate with parents and teach them safe sleep practices, we hope that sleep-related infant deaths will decrease. And here are our references.